We're actually talking about a rather general topic today, fever. We've all had one, and if you're a mom or a dad, your kids have definitely had one. Have you ever really thought about what causes a fever or what to do about a fever? Well, that's exactly what we're talking about today. I'm Sarah King, and I have a lot of questions. Hormone replacement therapy. Will that increase your desire to want to have sex? You gotta get that protein. Get that protein. Ladies, you need the protein. Do you think it's been exaggerated? If I have sex the night before my pap smear, can it mess up my results? In this show, I get to ask WakeMed doctors any question I want, and bless their hearts, they have all the answers. Sarah Has Questions is a production of Mix 101.5 and Capital Broadcasting Company, and it's presented by WakeMed. We are tackling a hot topic today. I'm really sorry. It's a bad joke, but it's we're doing fever. And I have Dr. Strahenya Talic with me today. You are a primary care physician with WakeMed. Welcome.
Thank you. Happy to be here.
You probably see a lot of fevers in your practice.
Yeah, it's pretty common, especially this time of year. Fevers are fairly common, yes.
Yeah. Well, and I did not think I'd be able to think of any questions because, it's just like it's a fever. It's extremely common.
Yeah.
But it turns out once I started thinking about it, I got a lot of questions.
Oh, yeah. Fevers can be a nuanced topic for sure.
Yeah, which it surprised me. So we're just going to start from the top,
okay.
Which is what causes your body to have a fever?
Yeah, so our body generally does a really good job at regulating our temperature, and it's all a balance between temperature production and temperature loss.
Okay.
There's a part of our brain that does a really good job at regulating this through metabolism, known as the hypothalamus.
Mm-hmm.
So when fevers occur, it can be caused by either infectious causes or non-infectious causes. And the infectious causes that you think about are generally things like viruses, bacteria, sometimes fungi or parasites can also cause them.
Ooh.
But what happens is they can bring along toxins that actually act on the hypothalamus, increasing production of certain chemicals that actually increases the set point in our hypothalamus, which ramps up our metabolism. It can actually signal the blood vessels in our skin to start to constrict, which is why people start to shiver and feel cold.
Oh, interesting.
That actually drives our body, our behavioral responses to cover up with blankets, turn up the temperature in our homes, and that's really aiding our body in increasing the temperature in our bodies.
Interesting.
And it's more of a physiologic response to get our immune system ready to fight off whatever infection is present.
A physiological response. So you're saying a virus, a fungus, which is disgusting, or a parasite getting into our body has a mechanism within it that triggers the hypothalamus to raise we're not 98.6 anymore. Now we need to be at 103.
Yeah. So they can bring toxins along with it that can trigger our hypothalamus to do that.
Okay.
Usually those are bacteria
that
have toxins within them. So things like E. coli, they have this compound called lipopolysaccharide, which can directly act on the hypothalamus to increase it. But it can also interact with our immune cells, and our immune cells can actually release particles or help to release particles through our body that ramp up our temperature as well.
And I'm sorry to seem like I'm totally reiterating, but you said that whenever the immune system also produces a toxin or a chemical that causes our muscles to constrict and causes us to shiver. Why is that helpful?
So it's really just given our immune system a kickstart. It really helps our immune system operate a little bit more efficiently. It's been a process that's been found in the animal kingdom for millions of years. It's more of a response to help our bodies fight against these infections.
We need to be hotter in order to fight the disease?
To a degree, yes. No pun intended.
But I like it. Proud of you.
Yeah. Thank you. I try.
Well, this is a question that I know a lot of mothers have.
Yeah.
Are we contagious? I mean, everyone has this, I guess. Are you contagious while you have a fever? And what about before or after the fever?
Yeah, so it really depends on when you get infected. But I would say in general, when you have a fever, if you're talking about a viral infection, sure, during a fever, you are prone to being infectious.
Okay.
And what I generally recommend people do is if you're going to go out in public or go to the doctor's office, I would definitely recommend wearing a mask.
Honestly, is this not the one good thing that came out of the pandemic? Is
Yes.
like the fact that people can actually wear masks in public now?
Yeah, and I didn't really think about it much before I went to medical school and through training, but now it's second nature to me. Honestly, if anyone has just sniffles or even what they think is a sinus infection, I'll wear a mask in those rooms because I worry about them spreading illnesses.
Sure.
So I do think that we're a little bit more accustomed to wearing the masks, and definitely recommend people with any sick symptoms wearing those masks to prevent the spread of these viruses.
Yeah, absolutely. All right. So you're saying we are definitely, while we have a fever, most likely contagious.
Yes.
What about before or after? My point is do you have to have a fever? Is that the only indicator that you're contagious?
Not necessarily. So it takes our body a little while to actually mount a fever response.
Okay.
So sometimes people say, well, I feel like I'm starting to get a little ill.
You get that gross rundown feeling.
Right. And it takes our body a little bit of time for that fever to really ramp up. So you may be contagious to a degree beforehand, but I would say that definitely during the fever, you're probably the most contagious. The downtrend of the fever usually means that your body is
winning,
yes, and has gotten rid of whatever is causing your immune system to, increase your body's temperature and, cause the fevers. I usually just tell people to take precautions even after their fever has come down. Usually for 24 to 48 hours after a fever happens is, I feel like, generally a safe window. But there are various different factors that can influence someone's contagiousness as well.
Well, speaking of ramping down, what's with sweating when your fever breaks? Why does that happen?
Yeah, so similar to when a fever is mounted, your hypothalamus sets that temperature up. When the body is recovering and you're not having all those chemicals circulating through your body, your hypothalamus brings your temperature back down to the normal level. And when you think about when the body's constricting those blood vessels to raise your body temperature, it does the opposite. So it actually starts to dilate your blood vessels. So you might feel flushed and you might start to sweat. And actually sweating is a mechanism that our body uses to actually help to bring our temperature down.
Right.
Because the water and the sweat can actually help to offload a lot of that heat that our body is producing.
I never thought about that. That makes so much sense. Because in the summertime, you know what sweat does.
Exactly. Yeah. So similarly, the behavioral responses will kick in as well. So you'll start, taking off your sweaters. You'll start, remove the blankets. You might bring the temperature down in your home as well.
Oh, interesting.
So yeah.
Can a fever temperature be different person to person, or is it always the same?
Oh, absolutely. Temperatures can vary due to different factors. Things like body mass index. People who are thinner might have a lower body temperature at baseline. People who are of elderly age can also have lower body temperatures. Things like hormonal imbalances. People who have thyroid disorders may have different temperatures. And the range for a fever might be different for these people. So you have to take some of those other factors into consideration when someone's saying, I feel a little bit warmer. My temperature is usually this, but now it's this level. So yes, temperature can vary person to person. Absolutely.
Okay. I'm going to move over to children now real quick.
Okay.
Because I don't know if you have kids, but when you have your kid in daycare, they tell you that you have to wait a full 24 hours since the fever has broken.
Yes.
Is that really a benchmark, the 24-hour mark?
I'd say it's a pretty universal benchmark that a lot of people say or have. I will say I wasn't trained in pediatrics. I don't have kids myself, but I say in general, I think the 24-hour rule is generally safe to follow. Out of abundance of precaution, you can extend that out by 48 hours, but in general, 24 hours usually.
So once your fever breaks and you haven't had a fever for 24 hours, you're pretty much better.
Usually, yes. Usually, your body may be shedding a less amount of the virus or viral particles. When your fever has broken, usually that means that your body has essentially won the fight against the infection.
I like how you said that. Makes you feel strong.
Yeah.
I've always wondered, why is 104 fever, 105 fever in a baby? Granted, it's a little tricky at 105, but it's not like if I popped 105 fever, I'd be in the emergency room. Why do they pop such high fevers?
Well, it depends on what age group you're talking about. Usually like newborns and infants, they haven't developed their immune system fully to fight off these infections. So they really rely a lot on those antibodies that they get from the mother to fight off some of these infections.
Is that through mother's milk?
It can be through mother's milk, yes.
Can it be through other ways from the mom?
So there are some vaccines that they recommend mom gets beforehand that will give the antibodies
while they're in utero.
Correct.
Got it.
But temperatures in young children can pose a lot of risks. So febrile seizures is one of those. So when the temperature gets so high, they actually run the risk of developing seizures. But some may argue that fevers are overtreated in some instances.
I actually have heard that.
But, when the fever gets that high, when it gets really, really high, they do run the risk of developing things like seizures, which is, can be an emergency.
Yeah, absolutely. Are there any symptoms attributed to fever aside from just an elevated temperature?
Yeah, so some people may develop body aches. So a lot of those same chemical compounds that cause fevers can actually be released throughout the other parts of the body that cause joint aches, fevers. It depends on also, what is causing the fevers. So if it's a virus, they may have upper respiratory symptoms like cough, runny nose, congestion. If it's caused by bacteria, that can sometimes lead to more severe symptoms like severe pain in areas. Yeah, if you have an abdominal infection, sometimes people can have really severe abdominal pain. If you have a head and neck infection, that can lead to pain there. So it really depends on what's causing the fever.
Yeah.
But in general, when we're talking about viral infections, you can expect some muscle aches and maybe some joint aches as well.
I sometimes will get hives or rashes with my fever.
Okay, yeah. Some people can react differently to fevers, and how the blood vessels look or interact with your skin can make the skin look a little bit different.
I'm very
sometimes.
sensitive, Doc. Very sensitive. Okay, so I know I keep bringing back to kids, but as mothers, we have to be doctors and trainers and chefs and all kinds of stuff. As a mother/doctor, not real doctor, I've always wondered if my kid's got a cold and all of a sudden pops a fever, does that mean he's got the flu?
Not necessarily the flu. There are various different viruses out there that can cause fevers. I would say the most common ones that we test for in the clinic are flu and COVID now.
Yeah.
But there are just so many viruses out there that outside of flu and COVID, generally people do pretty well with these viruses. And the body, if it's healthy, can usually fight off these viruses with not too many ill effects.
Okay.
Yeah.
At what point, if I'm sick, should I be worried at what number should I worry about my fever being dangerous?
Yeah, so it can vary person to person. When people start running into the 103, 104 territory, I start to get a little concerned. Also, if your fever has been going on for longer than, I would say 3 to 5 days, really.
Okay.
If your fever has been prolonged, then that might be reason for concern. And I would say in general, if you have a fever and you have any questions and you can consult with your primary care provider, that's absolutely, I think that's a perfectly reasonable thing to do, because they can assess you, they can see what other symptoms might be going on. There may be other symptoms that are worrisome and that you might need to seek more urgent medical care for. So I would say that, the fever number, maybe 103 to 104 and above can be,
in adults, yeah.
In adults, yeah. Can be a little worrisome. Once you start hitting like 105, 106,
Have you seen a 106 fever?
I have not, but I would say go to the emergency room with fevers that high.
Yeah.
Because the body can those fevers can do damage to the body, and you might need to seek more urgent medical care in that case.
Okay. And speaking of care, what's the best course of action if you do have a fever?
Yeah. So it depends on, again, person to person. In a normal, healthy adult, there are really two schools of thought. You can treat a fever if you're feeling bad, if you're feeling crummy, like go ahead, take something for the fever, as long as it's safe. So typically we tell people Tylenol and NSAIDs like Ibuprofen are okay to use, as long as you're fine to use those under the direction of your provider. But also they can be used for the other symptoms like the aches and pains that you have associated. I don't think that anyone should really suffer through a fever. But if you're just talking about a fever in a normal, healthy adult person, Some people argue that maybe letting the fever run its course
That was my next question.
Might be helpful. But there's no really consensus on what to do. There really isn't any solid evidence to suggest that treating the fever is necessarily beneficial. But also, if it's not risky to let the fever run its course, then you might actually get better a little bit sooner.
That's what I was going to ask. Yeah, that makes sense because its job is to ramp up your immune system.
Right.
So I mean, maybe give it like a day,
Yeah.
and then if it's still there, be like, okay, I'm miserable.
Right.
Yeah.
And I certainly wouldn't be treating around the clock with any of these medications. I would say,
Let it
listen to
rise up for a bit, and then after a while, take it down.
Right. Yeah. So, look at what your body's doing. And you don't want to be taking these things around the clock because you really want to see how your body is responding to this illness. And you want to know how long this fever is going to run its course too.
Okay, great. Is there a difference between a low-grade fever and a high-grade fever and what it might indicate?
So I think people have varying definitions on what a low-grade fever can be.
Yeah. For me, it's like 100 degrees.
Yeah. I would say that 100 degrees, some people will argue 100 degrees is a fever. I would say that that's more or less a low-grade fever. High-grade fever, if you're, in 100.4 degree range and above, definitely when you're hitting the 101, 102 range, those are more of your high-grade fevers.
Okay.
I think everybody responds to these things differently. I don't know that it necessarily means that your body is fighting better. It really depends on what other symptoms are going on
right.
too.
Why do fevers get worse at night?
Our body, when we sleep, the metabolism is at its lowest. So in the morning, you will actually notice that your body temperatures, this is even in just normal everyday life, your body temperature will be at its lowest in the morning because your metabolism tends to slow down when you're sleeping.
Okay.
And when you're up and moving around, when your body's actually active, your metabolism boosts. So that may actually lead to your temperatures being higher at night. In normal everyday life, this can be up to 0.9 degrees Fahrenheit. In a fever, this can be as high as 2 degrees difference between the morning and in the evening.
Oh, wow. Okay. Yeah. So it's just the fact that you've been awake and living.
That's what I would. Because
there's a old wives' tale that I've heard, which is if your symptoms get worse at night, that means it's a virus versus a bacterial infection. Is there any credence to that?
I wouldn't say that there's any real credence to that. That's interesting. I haven't heard of that, but
I've got country folk in my family.
I don't think that there's necessarily any, at least no science that I know of behind that.
You mean a country adage isn't true? No way.
No. In my culture, we have all sorts of old wives' tales as well.
Sure.
That we, and multiple different home remedies that,
All I know is Vicks Vapor Rub on your feet supposed to cure everything.
Yep. Yep.
Talk to me about fever-induced nightmares. What's going on there? You've never experienced this?
I haven't experienced this, but
really, I definitely have. They get wacky when I have a fever.
Yeah, dreams are really, really weird. Dreams tend to. We really don't know exactly what dreams come from.
Yeah, the science on sleep is so fascinating.
Yeah, and there's some theories out there that dreams really arise from our body, our brain is still kind of active in the background a little bit, and parts of our brain need to be activated. So the visual cortex of our brain might be a little bit more active during the night and lead to dreams.
Right.
I don't know if fevers may just accelerate this response, or maybe it's the brain's way of saying it's in danger.
Yeah.
And maybe it's leading to some of those more nightmare type.
Like wacky. They're just weird.
Yeah. I guess some people do refer to them as like fever dreams almost. They're very, very strange. But I think fever brings maybe a little inflammation, and maybe that inflammation is just the body's way, or the nightmares may be the body's way of saying it's in danger.
Yeah. Yeah. I mean, and also while you're awake, sometimes you kind of feel delirious when you have a fever.
Yeah.
And that's, you think, from the inflammation?
It can be. I would say that people, age groups, I think the elderly are more prone to feeling a little bit more delirious. Sometimes they can actually get pretty confused at times.
Yeah.
But I would say definitely the inflammatory response, as well as maybe some low level of dehydration as well.
Oh, yeah.
And it's always important to also maintain your nutrition during fevers as well, because your metabolism is ramped up, so your body's using up more energy.
Good to know.
Yeah, so it's using a lot of the proteins and fats throughout your body. It tends to use less carbohydrates during fevers.
Okay.
Because bacteria love sugar, and your body is trying to reduce the amount of sugar in the bloodstream.
So no, you want to eat protein and fat.
I would say, focus on proteins, fats, things that are easy to eat.
Because I've always heard the adage where I got a lot of these today. I don't always have these, but you're supposed to feed a cold and starve a fever, and that's just not true.
I would say no.
Okay.
I would try to maintain a good, adequate nutrition during a fever. I wouldn't say, stay away from carbohydrates 100%, but try to get some,
like chicken soup.
Yeah, try to get some calories in, try to get some good protein, some good fats in. Try to give your body the nutrients it needs to, really
fight.
help it fight through these infections.
Well, before we cracked our mics, you were saying that there's a lot of nuance and things that go with fevers, and you didn't disappoint. Thank you so much.
Yeah, absolutely. Happy to be here. Thank you for having me.
Not starving a fever is news to me. I mean, that adage has been with me for as long as I can remember. Kind of just blew my mind. Thank you so much to Dr. Talic. And if you have a topic that you wish we would cover on Sarah Has Questions, you can always DM us on Instagram, Sarah Has Questions. Leave a comment below on our YouTube page. And if you'd like to tell your friends about it, well, let me tell you, we'd be very grateful. Leaving a review also is a great way to spread word about this podcast. And as always, thanks to Wake Med for making this happen. And stay well, my friends. We'll see you next time.